What's up, guys? Dr. Hunt here at Hunt Physical Therapy. Today we're going to talk about hip arthritis and what you can do about it. So the most common type of arthritis that I see in my practice is osteoarthritis, which is that progressive thinning and wearing down of the articular cartilage between the bony surfaces of the hip joint. Over time, that can result in pain, stiffness, decreased function, loss of range of motion, and maybe even bony changes. So what causes arthritis? So we think there may be a genetic component in some people, wear and tear over time. You see arthritis more in people midlife and beyond, and there's a reason for that. Also, there may be history of an injury or trauma in the past, which caused inflammation, which kind of started that cascade effect of the development of arthritis. But like I said, there's things you can do for it. Interesting study I read years ago revealed that a lot of people walking around without any symptoms at all have evidence of arthritis in their joints, their knees, hips, and even their lower back. So those of you out there with arthritis, take heart. There's things you can do for this, and having arthritis is no guarantee of having pain. So I always recommend trying conservative things first. So now, let me show you some of my favorite things that you can do for hip arthritis. Okay, let's go. All right, guys, like I've said before you do any kind of exercise or stretching, especially those of us that are midlife and beyond, the warm-up is essential. So either walk around to tolerance for about 10 minutes. If you have access to a bicycle, cycling is great, it's low impact. And so do that for about 10 minutes before you do these stretches and exercises. So the first stretch I'm going to show you, I really like this. I've had really good results because I think a lot of people with arthritic pain, they're just tight in that hip joint. You know, when we're a kid, we're playing, we're running, there's that diversity of movement. We don't get that near as much as we get older. You know, we have a lot of responsibility, we drive to work, we sit all day. And so I think a lot of people, the arthritis is exacerbated by just that diminished range of motion in the joints. So this is a stretch I like to do. My patients, if their opposite leg can tolerate, so let's say the arthritis is in the left hip. So basically just flex the knee up, bring it out, rotate in, and then kind of kick behind you like that, okay? So again, flex the knee up, bring it out, we call that abduction, rotate the knee in, and then kick out like that. And what that does, that just puts that hip joint through a variety of motions, just motions it's probably not used to, just to loosen it up. And do that for a few minutes at a time. So just like that, just to loosen up that hip joint. By the way, if any of these stretches and exercises I show you, you don't tolerate, you don't have to do all of them. So I'm gonna bring up right now while I'm thinking about it, after I show you these stretches and exercises, if you want more, our video that we dropped about best leg exercises, you can certainly try those, and that would only benefit the hip. But anyway, back to the hip stretches. So hip flexor stretch, to stretch out the front of the the front of the left hip, basically stand with that leg back, and then hold on to something like a wall. I've got this bar here, but just sink forward like you're lunging, and you can see how that creates that bowing action in the front of the hip until you feel a good stretch. A lot of people are tight in the front of their hips because, again, we sit a lot. There's great things on television at night. We commute, we sit at desks now. I'm a physical therapist, so I'm on my feet a lot, but even I'm sitting at my desk a lot doing documentation. So again, hold this 30 to 60 seconds, like I say with all our stretches. I'll demonstrate on the right side just because. Just lunge forward to create that bowing effect to stretch the front of the hip. All right, guys, let me show you a couple things you can do against a door. Come on. All right, guys, now I'm going to show you a couple of exercises you can do against a door or a wall. The first one, you sit with your back against the door. That just kind of promotes good form. So put your feet together. This is called a butterfly stretch, and it stretches the inside of the hip and these muscles on the inside of the leg called adductor muscles. So to do this, feet together, slide the heels back towards your body like that until you feel a good stretch inside your legs. To make it more advanced, you can take your elbows and push down, or push out rather, like that, or you can kind of use your hands and add a little overpressure. But you can do this every day, hold 30 to 60 seconds. The next stretch is for the front of your hip. It's a little more advanced than the standing hip extension, but lie face down with your knees against a door or a wall, like that. okay? And then come up on your elbows to stretch out the front of your hip joint like that. Take some deep breaths and just relax into it. You can make it more advanced by pushing up farther with your hands. And you'll feel a nice stretch, like I said, in the hip joint and the muscles and connective tissue in front of the hip. Hold this 30 to 60 seconds. You can do this every day. All right, so now let's go in the room on the table, and I'm going to show you some more stretches and exercises you can do for hip arthritis. All right, let's go. What's up, guys? Now I'm going to show you 2 more stretches and 2 exercises you can do that are excellent for hip arthritis. So the first stretch stretches the hip joint right in here. Cross your leg like this. And a mistake I see my patients doing, they kind of slump like that, which kind of stretches the lower back and doesn't feel so good. So what I want you to do is maintain the arch in your back and act like you're bowing, like that. That really stretches the deep muscles of the hip that connect directly to the hip joint. So if you're suffering with arthritis and that joint's gotten tight and compressed, this is a great stretch to do. And you will absolutely feel that over there. So again, cross your leg like this and act like you're bowing until you feel that stretch there in the side of your hip, okay? An alternative stretch that's good for the front is to lie in your bed. You know, a lot of beds now are taller, so this works perfect. So let's say we're wanting to stretch the left hip. Basically scoot real close to the edge of the bed so that leg is hanging off. You can already see how that's probably stretching the front of the hip there. And then your opposite knee, just bring it to your chest like that. And just hold that 30 to 60 seconds. It's a great stretch for the front of your hip. All right, so let's talk exercise. So you can get these little bands at HpT&x or really anywhere now, Walmart, Amazon, but we prefer you shop at HpT&x. So take this and put it around. So it's around the top of your knees, and we're gonna do some bridges with resistance. You've seen me do bridges a lot in my videos. They're just great exercises. So the bridges strengthen the hamstrings, the abs, the hips, just a great exercise. And throwing the rubber band forces you to kind of engage some of the hip muscles while you're doing your bridge. So lift up, smooth motion, maybe pause a few seconds, and come down. Okay, 3 sets of 15 a few times a week. Clamshell, leave the rubber band on and do this on both sides, but I'm just going to demonstrate on my right side. So keep your feet together on this one. You don't want to lift your feet up. So keep your feet together and lift your top leg up towards the ceiling like you're creating a clamshell. And if you add a little resistance, you feel this one fast in those deep hip external rotator muscles. And it's low impact, so this is a great way to strengthen the hips. Okay, all right, 3 sets of 15, a few times a week should be sufficient there. All right, let's go out to the gym, and I got a few more exercises I want to show you, and we'll be done today. Let's go. All right, guys, final 2, wall squats. Really good for the hips, really the legs in general. Stand with your feet about 1.5 feet or so away from the wall. If you add the rubber band above the knees, that kind of engages the hip muscles and gives it a little layer of complexity that benefits the hip joint. So basically squat down. Listen to your body at first, okay? Don't try to go really deep. Build up to that. 3 sets of 15 a few times a week. With the feet away from the door, it kind of engages the hip muscles a little bit more, and so that's why I like to do this with my hip arthritis population. Plus, they can control the depth. Okay, and leave the rubber band on and do some side steps to work those lateral hips. So basically take 3 to 5 steps one direction, and then 3 to 5 steps the other direction. It's nice to have the knees soft. What I mean by that, slightly bent when you do this. I think that engages the hip a little bit more. And do this. On this one, I kind of get lost counting reps, so just do this a few minutes at a time. 3 to 5 steps, one direction, and then back. All right, once that hip feels better, you can check out my other video, best leg exercises. There's a little bit more detailed exercise in there for the lower extremities. Try that. And anyway, that's it, guys. Hope you liked the video. If you did, show your support by subscribing to my YouTube channel. And we look forward to seeing you next time. Take care. Bye.